Wow, look how red the eye starts getting, huh? When you start poking at it. She has beautiful eye color, though.
You see that? He's going to put the alcohol in there for 45 seconds. See?
Uh-huh.
That's going to deteriorate the epithelium.
But hers isn't common, right?
No, yeah, it's very thin. It's the opposite.
Like
The layer.
it's not the laser, normal laser.
No,
Oh, I
the
got
laser
it.
wouldn't have done it for her.
No.
He said it wouldn't have worked. The laser works for the LASIK film works for the thick layer, which is the most common condition. Christina's was thin deteriorating.
Do me a favor.
Yeah.
Try not to push too much to
Okay.
the glass.
Okay.
Thank you.
Is that better? Is that better? What's the difference if I push the glass? Is there a difference? Oh, I can't watch. Okay.
Yeah, you can record it.
Huh?
No? Well, you can record it.
I can't watch.
Why not?
That's my daughter's
Look
eyeball.
at the alcohol. He's scraped. Look, he scraped.
Wow.
You know, it's amazing because at UN when we did the open heart, there's 20 people there, 25. There's 1,000 residents. My whole team is there. It's about 25 people, one patient.
Do you know that a friend of mine from SBS, from the radio stations, our traffic manager, 42 years old, both heart attack and heart failure. Wait a minute,
42.
there's a name for it.
CHF, congested.
No, heart attack and oh my God, when your heart stops.
Cardiac arrest. 42.
7 minutes before the ambulance got to her house.
So he died.
No,
Man.
she's alive, but
Oh,
we
it's a shame.
think that she's completely brain frazzled.
Too much oxygen loss. Usually after 3-4 minutes,
Yeah, they say that really that cap is 5.
it's irreversible after that.
Yeah.
After 5, it's irreversible, the damage.
And he did CPR, but that's not.
It's not. The medications is what really fixes it right away.
Yeah.
You know where we're at?
And Palm Springs Hospital is the worst hospital in the world.
Oh, it is a madhouse.
So I don't know how the ambulance took her there. I don't know how the ambulance took her there. Because they did nothing for her. You know, you're supposed to give some type of
Yeah, the
medication
hospital,
to
yeah, of course,
to
yeah.
stop
There's an
the
algorithm that you have to follow.
right.
She's lucky to
She's
be
in
alive.
Jackson now.
She's 42. She's lucky she made it at that age.
Yeah,
The
she's on a
pressures are-
breathing tube. She's on a breathing tube.
When did this happen?
Monday, a week ago, this past Monday. It'll be 2 weeks this coming Monday.
She's still intubated, huh?
Yeah. They put you at 60 for the breathing,
Yeah.
and then they
ventilations.
start lowering it to see if you breathe on your own.
2 weeks is long for her. She should have been out of the tube.
Yep. And she's up to 40 now. So,
40 ventilations.
and her blood pressure is perfect, and her heart rhythm is perfect.
Does she move her hands and fingers?
Yeah.
That's good.
And she reacts to feet. Like when you touch her feet, she doesn't
Yeah.
like it, so she
Like
twitches.
Like a neurological
You know,
response.
yeah, like so there's some brain activity.
That's good. Wow.
I don't know
42.
how much. And she opens her eyes.
And chances are at
When I
that
went to
age.
see her on Tuesday, I was like, "Yos, you didn't put my orders in. Oh my God, my commercials aren't gonna air." And then she opened her eyes like, but she never focused on me. She looked, she's just.
Yeah, I mean, it takes time, but it takes a long time. But they have stem cells, so that's gonna be the future. Stem cells are gonna fix all that. All that necrosis, that tissue in the heart, the stem cells are gonna fix it. Remember that.
Yeah.
So now you have
Hi. Good.
That's it.
That's one. That's one, right? One. And that's the other one?
Yes. You know, Barb, she's very lucky to be alive. At 42, the chances are you have it.
Well, she was already on a heart transplant
Oh,
list.
she was on the list?
Oh, yeah.
Oh, okay, so
She has an
that's-
enlarged heart.
Oh,
and
she has
she's-
cardiomyopathy.
And she's, I would say she's about 350 pounds.
Wow.
She's extremely
Is
overweight.
she a smoker?
No,
No.
extremely.
So she must be Dr. Bowen's patient. I know the transplant unit there.
Oye me, they had to ask, SBS had to intervene. Our CEO had to call Jackson and pull a favor and say, take her out of Palm Springs and accept her there. Someone's got to be responsible for her over there.
I'm sorry, they have no capacity. It's like an urgent care. They stabilize.
It's horrible. They'll just stabilize you and that's it. She should have been out of there the next day.
I don't what? How far was she from Jackson?
He says she lives in Hialeah.
Oh, maybe that's why.
He says the boyfriend says that they didn't have room for her at Palmetto General, which
Yeah,
probably
cardiac unit,
would have saved
Been
her.
better, yes. Been a lot better.
What do you mean you have no room for me? I'm a fucking paying citizen just like everybody else.
Only a Palmetto. It sucks. A little better, but the same shit. Doesn't happen anywhere. Doesn't happen. Jackson. You have a heart attack. Look, they could put you on the floor and we'll save you on the floor. You know, hypothetically speaking.
Yeah.
On the couch. You don't need a bed. You know, you could do it on a stretcher. Right? To have the meds. The devices.
What a shame,
But I
huh?
could do it.
I don't want to live in Hialeah ever.
But I could do it. And listen, Barbara, it happens all the time. We hear the stories when the patients come to us. We're like, this is happening.
How about Mariners? Is that an okay hospital?
Mariners?
That's Baptist.
Yeah, it doesn't have the capacity that November. It's forced. It's like.
Okay, so where do you go to get your life saved if something happens like that?
Jackson South.
Oh, Jackson South. Okay.
Yeah, Jackson South.
Okay.
That's bad. Definitely not Kendall Original. You don't want to cut Kendall.
They have a heart unit though.
Yeah, Kendall Original.
A new
Yeah,
one.
yeah,
A new
but
heart
you know,
unit.
Yeah.
I know they used to kill people before.
Yeah, because they're all about productivity, bar. You know.
Yeah.
Yes. Too much about. There you go.
So that's the laser he's beaming in her
That's it.
eyeball now. I guess I was making noise pushing the glass in.
Yeah, I guess they heard the crack.
Oh.
Tiene fuerza.
That's like a sponge, huh?
Yeah, he says full of alcohol. Then they're gonna put the contact in there. There it is. There's the alcohol.
More laser?
Some moisturizer. Antibiotic drops.
Hey, you know this procedure.
He explained it.
Oh.
Pretty fast.
There's a lens.
There's a lens that's gonna act as the layer that he removed. No problem.
Do they remove that layer?
Yeah, it's gonna be. Yeah, that was it's causing her the problem. And
Poor
she's-
baby.
And she's gonna leave the length until